Welcome, my dear audience and friends, to Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. For the newbies, this show aims to demystify the cancer disease and to bring on experts and stakeholders in the cancer space to come give their take. I always harp that, everybody does their medical checks because until there's a cure, prevention is the cure. Now, we all know that the pandemic has sped up the advancement of telemedicine and digital tools, and they are now in the mainstream of the healthcare ecosystem. We as patients and survivors and caregivers too, we have to be on top of our game, try to feel comfortable using these new tech solutions to manage our health, and yet nothing is perfect. There's still many rivers to cross. The digital divide rears its ugly head now and again, and then companies are faced with the uphill task of having to narrow the gap between the haves and the have-nots, I should put it that way. So the issue of clinical trials and diversity, accessibility, and affordability plays a huge part in these circumstances. So while these innovations are welcome, there will always exist the power of the human touch and presence. And I, for one, as a patient and survivor, I will always prefer to see my doctor than any other person on a screen. But regardless, it is the 21st century and we must adopt and adapt. So in this episode, I am so glad to host a lovely lady from across the pond in the United Kingdom who is a pharmacist, an entrepreneur, a health tech advocate, and who values tech innovation to transform healthcare delivery to achieve better outcomes. In addition, she's an advocate and champion for diversity, accessibility, and inclusion in tech. We will be discussing the pros and cons of digital health as it regards women's health. So, without much ado, let me welcome the lovely Erica Okpari to the show. Welcome, my dear Erica, and I'm so honored to have you. Thank you for coming.
Thank you so much. Thank you. It's a pleasure to be on the show.
Yes, indeed. So, whilst I've already introduced you and all that, so I won't, kind of repeat myself, but let's just have a brief introduction of you, family, education, please.
Right. So I am one of four. I'm the eldest. I have two brothers and one sister. I am also a mother. I have two boys. So I'm a boy mum, two very energetic boys, 6 and 3. I'm married also to my husband. He's also one of the healthcare professionals. So he's also a doctor. And I am of West African origin. So I'm Ghanaian by origin. Born in the UK, lived in the UK pretty much all my life. I just said I was a qualified pharmacist as well. So I did my master's degree, it feels like ages ago now. I've been a pharmacist for over 15 years. Wow. And I've worked across various sectors in community pharmacy, in hospital pharmacy, and now in commission support, whereby within the NHS structure, the clinical commission groups, we commission services via primary care. So the GP contracts and medicines, prescribing and so forth, that's part of my remit. Yeah, that's pretty about me, really.
Awesome. That's really good to know. So you're right in the mix of the healthcare system.
Yes, in a way, yeah.
Awesome. So what actually drew me to you was your passionate interest in menopause. And this actually pleasantly surprised me. During our brainstorming sessions in the early days, you mentioned that you're not menopausal. And I'm like, okay, what's this young lady doing in such a niche, Even though I do know that one time or the other in our lives, it's a phase that we have to go through. So how come you got involved in this area of women's health?
Interesting, really good question. So a friend of mine was talking about the menopause. So her mum was going through it. So, Erica, we need to maybe look at in terms of tech solutions for the menopause. And I thought, really? Prior to that, I knew a bit about menopause, but not so much. So when I started doing some more reading about it, then I realized the lack of awareness within this space. And as you said, every woman will go through this. They may experience some symptoms or they may not experience any symptoms, but nevertheless, a lot of women don't know about menopause. So once we started holding focus groups and just trying to glean, women's stories and how we could put that together to innovate a tech solution, then the awareness, almost our eyes opened. A lot of women were not talking about this, in a sense, within other circles. And when we were holding these focus groups, they were so happy because that was the first time they discussed their symptoms and their experiences outside, for example, their partners, not even their friends. So they kind of had this common type of sisterhood. And as we're doing these focus groups, a common theme again kept on recurring. Lack of awareness amongst the younger generation. They had no clue in terms of what the symptoms were. And also amongst the ethnic minorities as well. And women from lower socioeconomic factors, they weren't really talking about their symptoms. They weren't presented to their healthcare providers about the symptoms which they're experiencing, how to manage it effectively. So we thought this is something that we need to really raise more awareness about. The unfortunate thing as well is that some of the symptoms are deemed to be quite embarrassing, a bit taboo. So that also further hinders women going to the GP or the healthcare providers and talking about these symptoms. So this is where we see a potential where tech can bridge that gap. Of course, tech doesn't, replace the human contact, because we're all built for, for relationship, and that's what COVID is highlighted, isn't it? Although we do like our tech devices, but we do miss that community, we miss the interaction with people. So tech, in my opinion, can never replace the human element. That is key. We were born for connection, weren't we?
Yes, indeed. You're so right. So as an entrepreneur, I know, as you've explained, that you're very conversant with digital health solutions and all that. So for those who may not be well informed about this, what exactly are digital health solutions?
Okay, so can really kind of break it down. There's a lot of different definitions about it. So digital health solutions is pretty much about healthcare systems and how technological solutions can bridge that gap. So by using smart devices, data analytics, software platforms to be able to increase access to these services. So what does it look like? At the moment, because of COVID, it's highlighted. Online consultations are taking place, remote monitoring, smart devices. So you may have, for example, GP may want to check up on their patients. So for example, the blood pressure monitoring and so forth. That's what all these different devices and tools are able to enable prescribers or physicians to manage certain chronic diseases and so forth. So that's just bridging that gap between tech and healthcare services.
Oh, wonderful. So what are your, even though, you are a health tech innovator, I should say so, but what are your personal thoughts about these products and devices, and how, knowing the level of inaccessibility now to certain populations, how can these devices be used to raise the level of awareness surrounding menopause, especially, which is your primary area of focus?
Okay, so just give one little example. So I have a friend who's 89 years old and he lives alone. So he's very old fashioned. He loves to be able to go to his, healthcare physician and see him and so forth. So in terms of using a tech solution, that may not be would not be appropriate for him, because he has struggles. He has, barriers. For example, digital literacy, not very literate in terms of the internet. And so even though he does use Facebook, and then you look at the other extreme, whereby there are lots of different apps and software platforms for women experiencing menopause, which is deemed to be really effective. So, give an example, there are apps called Caria and Balance, whereby you get a way for women going through menopause to track their symptoms, and also ties them into a community where other women can converse with other women in terms of discussing their symptoms, what treatments are deemed effective, just kind of that sisterhood and community. So that, in essence, the tech is able to really connect women from all over the world and just share their experiences, which is really sometimes women going through menopause can feel very lonely and isolated because they think their symptoms, is it just me that's experienced? When you say a problem shared is a problem halved, that's what the tech fosters, that community. And also accessibility to certain services. So you've also got software platforms whereby you can do this remote consultation. So you have, menopause health experts that are able to have these consultations with women going through menopause. Some women can't get to their physicians. Some of them they do. They are almost bubbed away and said, oh, come back when you have more symptoms.
Mm-hmm.
But tech enables the opportunity for women to be able to access these services. On the flip side, these services can be quite expensive. So therefore, we are therefore not representing some communities that may not be digital literacy, that may not have the internet or the broadband or these expensive devices, or even have the
Mm-hmm.
money to be able to access these menopause health specialists.
Mm-hmm.
So that's where we see the issues are. So you've got disparity. Again, as you mentioned, the haves and the have-nots. And this is where we need to really, when we innovate these tech solutions, we need to involve as many communities as possible so we can co-create tech, not necessarily tech, but also maybe an information, maybe a community hub where women from different communities can go together and just see what the solutions are. Often when there's an issue, we think tech is the answer, but tech may not be the answer. It may just be a pamphlet listing the symptoms of menopause, or maybe a community hub center. Maybe if a community health worker goes to the community and just
Yes.
explains what to expect. You see,
Yes.
so yeah.
Yeah, you've raised fantastic points. The digital divide, raising awareness, especially for underserved communities, health literacy, digital literacy also, because we find out that based on what's happening now, the pandemic has opened up doors to people trying to learn more about these health tech solutions and how to have good quality of life going forward. Um, so for, like you said, the pros and cons to everything. I would like to find out how you think those communities that you speak about and intend to target or are targeting, let me put it that way, how can you arm them with that sense of awareness, that heightened awareness? Because yes, they could know about it, but how could you actually raise the level and let them know that these things are could be affordable and could be accessible as well. What would you be doing to get it across, that information across, please?
Yes, so with any innovation, you need to involve the relevant stakeholders. So you don't want to be innovating a device or solution or service when the people that are going to be using it are not involved in that decision. They need to
Yes.
be involved in the most earliest point. And this is where I'm really passionate about the co-creation and really iterate as many times as possible to ensure that they are involved every step of the way. Now, some innovators may not believe in that way in terms of,
Mm-hmm.
we know what's best for our customers, but we know that something is not quite working there. It's not working because otherwise they won't know that these solutions are out there.
Yes.
So for me, the focus is really getting as many women's voices and stories as possible, to holding these focus groups and just really understanding what would enable them to access these services. So that's the first thing. And also finding out what would warrant them to access these services. A lot of women think that they don't think it's necessary to go for these tech solutions because things are working fine. But this is where tech can be really useful, because tech, as we see in this current pandemic, has been able to bridge the gap to improve access to certain services. That's the ones that are free. The premium ones as well can be quite expensive. So some of these kind of remote monitoring devices and Fitbits and so forth could be quite costly. So this is where we
Absolutely.
want to be able to ensure that these prices are reasonable by asking what is an affordable price, and just really going with them every step of the way and involve them to make sure that it is affordable, not assuming that it is affordable, because
Mm-hmm.
everyone's economic condition is different.
Mm-hmm.
And that's the thing, you need to have people that are different to you, because sometimes we can be in a bubble. We think that this is my life. And when I came into the tech sector, the digital divide was a completely new thing to me because I wasn't even aware of it, because obviously from my background and so forth, and really understanding this, I thought, oh my goodness. So it's by really informing yourself, but how do you do it? By ensuring you're having discussions with people that don't come from the same environment as you, different backgrounds, because then you start thinking different. And when you start thinking different, you can start innovating products to involve as many people as possible. This is what we call inclusivity, but also diversity. And they both marry each other to that's where the magic happens. And then when there's the buy-in, they're most likely to use and adopt these tech solutions. So
Yes.
these are my thoughts on that.
Oh, those are fantastic thoughts, and those are fantastic insights. You mentioned something. Let me go back about having hubs. that would focus on women menopausal women, especially since that's your area of focus. You know, we're Africans, and we know that up until this 21st century, the subject menopause is a taboo. You know that, and you find out that you know, a lot of women don't even raise the issue that they're menopausal, especially from our climes, or that they're having these challenges, mood swings, night sweats, you know, a lot of the things and symptoms associated with menopause. So are we looking at trying to, especially for African women, how are we looking at trying to make them come out of their shell and be more forthcoming and open about their experiences with menopause and how to go about this?
That's a really interesting, good question. A lady that I know, she's of Nigerian descent, and she is also a women's health specialist. And so she holds quite a lot of these seminars with women from ethnic minorities. And she said to me that on one occasion she was doing this webinar, and then she was describing all the different symptoms that, you know, menopausal women tend to experience. And she posed this question to the women. They said, "Oh, I suffer with this, I suffer with this." And they said, "So who's going through the menopause?" And no one said anything. So, but these are menopause symptoms.
Exactly.
So the key is the awareness. We need to be having these discussions. And it's quite sad because a lot of women do experience it, they attribute it to menopause because
Yes.
their mother went through menopause, but then you know, it's generational as well. Because my mum, when she went through menopause, she didn't speak to me about it. I observed just from knowing a bit, which I read as well. So it's about having these conversations with mothers and daughters and friends, but also, as you said, community hubs, holding these events, almost education events,
Mm-hmm.
because then with information, knowledge is power. Then
Yes.
you're able to make informed decisions in terms of your health, because
Yes.
women are living longer. So we need to be investing in our health bank. And, you know, women are deemed to be, I think I put a post, 40% of our lives will be lived in menopause.
Mm-hmm.
That's just about less than 50%. So that's
That's huge. That is huge.
isn't it? And women are experiencing menopause even a bit earlier. So information is really the key, and we need to do this from community centres, through churches, from where we guess we hang out, and this is, you know, from our homes, just really getting women together and starting to have these conversations, because that's when the barriers will be broken.
Yes.
And I also find in terms of the other symptoms, I guess, you know, with when it comes to sexual health, because again, it's not something that, you know, within our culture is
Mm-hmm.
also taboo. So, for example, in terms of kind of the vagina atrophy, vagina dryness, all these things lead to sexual health, which is also very common in menopause, but
Mm-hmm.
women don't want to speak about it and they suffer in silence.
Mm-hmm.
So, by having these conversations, hopefully breaks down these barriers so that women are not suffering in silence. So, the key really is about fostering environments whereby it's safe to have such discussions.
Mm-hmm.
And then from that way, they arm themselves with information and then can actually look for products and services to be able to manage those symptoms and feel comfortable then taking it maybe to their friends or to their partners, because it's not just a woman that suffers,
Mm-hmm.
it's her family, it's her partner, it's where she works,
Mm-hmm.
it's a whole network of, you know, relationships.
Yes. I'm thinking that to bring them also out of the woodwork, to have something like an Alcohols Anonymous kind of thing, have a Menopause Anonymous, if that's going to bring them out to be able to speak about their issues and experiences and all that, because that community, you know, of course, a lot of women are very held back, like culture. I mean, if I'm, you know, of a different faith, which doesn't actually like that kind of exposure, especially about sexual health, as you mentioned, and other things. There could be hubs of anonymity for women to, you know, have these, you know, like you said, pamphlets to say, hey, there's a group that will be starting, or there's a group going on if you want to hide your identity and all that. That could be a way to actually start drawing out not just us that come from, you know, exposed communities or exposed backgrounds that can actually talk about it, but also as you talk about diversity and inclusion, ensuring that the other women that cannot speak about these things could be open to speaking about them in a closed environment. You understand? Because, like you said, suffering in silence, we all know
Yeah.
menopause is still a stigma, to be
Yeah.
honest. Um, I have met, as a cancer survivor, right? I have met young women who have been, who have gone into menopause as a result of cancer treatments.
Mm.
And, you know, the right information wasn't available to them to be able to probably save their eggs, freeze their eggs. But all these cost money, you understand? If I'm going to freeze my eggs until after my cancer treatments and all that, it's a lot of money.
Mm.
And sometimes, or most times, insurance doesn't cover it. So what
Mm.
do we do? So these are things that women should have been already, that information should have been availed, and then they'll be able to have options to say, oh, okay, I'm still in my 30s, and then I'm going to have about 2 years of cancer treatment. So what happens? I'm going to lose my eggs. I'm going to do this and do that. So that, what should I say? Information should be out there to say, a lot of a lot of us are young. We've gone into menopause not naturally, but because we have been ill. If any of you need information regarding this, as regards, you know, marriage and pregnancy and all that, reach out to us. I think that would be fantastic, you know.
I think so, absolutely. Because I'm not sure, you know, my mum, she had a hysterectomy, so that also another condition whereby it puts you into induced menopause. And I recall she never, I don't think she had any information on it at all, and she never sought any treatment. So she just literally suffered all the way through her symptoms.
Oh, wow.
And it's not uncommon. A lot of women from ethnic minorities tend to do that as well. They just suffer in silence.
Hmm.
And I love the fact that you said that it's about before going to any form of treatment, you're able to sit back, because it's a huge thing, whether, you know, cancer treatment or hysterectomy is a massive life-changing experience. You know, you've got that going on as well, but also the repercussions for your life, you know, if you haven't had children,
Exactly.
you need to be able to have time to process that.
Yes.
And also how you live your life, your health and well-being, your mental health, your emotional health, and also with the relationships you have, because it impacts every single thing that you do. And you know, information and knowledge is power. You need to be able to have make that informed decision. And you, as you say, freezing your eggs and all those things are really expensive. So this is something that, you know, the woman needs to be able to make the empowered choice. What do I do, rather than then going through it and think, oh my goodness, what do I do now? That's not a situation that a woman should be finding herself in. Not in
E-
this 21st century.
Absolutely. Not in this century. Correct. You have said it. You've hit the nail on the head. And as another thing I wanted to raise was the family
Mm.
and menopause, for the men to be drawn into the conversation, because a lot of times too, from where we come from, you know, a lot of women hide from their husbands. I mean, I've spoken to quite a number of women who have said, Grace, I have hidden. I mean, I still act as if I see my periods, because if I tell my husband that I'm menopausal, that attraction or whatever won't be there anymore, you know, or he
Mm.
might feel that, oh, okay, my time is up, and
Yeah.
look for young blood, if you know what I mean, you know where
Yeah.
we come from. So
Yeah.
I think that men should also be um, brought into the conversation to say, your wife is going to go through this. These are the symptoms. Don't lose your cool when she does, because, you know, she's not the cause.
Yeah.
It's the hormones acting up. Be as patient and as understanding as
Mm.
possible. That too adds to the mix of
Yeah.
letting our spouses, partners, children even know. Like you mentioned about your mom, she probably didn't want to, you know, make you panic
Mm.
or whatever. Not because she didn't want to talk. A lot of the women don't want to talk because they don't want to rock the boat. You
Yeah.
know, they've had a stable home, and they don't want anything that would make them be the cause of any instability.
Yeah.
So that too should, I believe, should also be a part of the solutions to create better outcomes going forward. I love this conversation, Erica.
There's just so much, honestly. And one story which I had, which is really sad, not to put her down on things, was one of these conversations. It was a podcast, and the lady said that her husband called onto the show and said that after listening to some of the menopause symptoms that women go through, he wouldn't have left his wife because she was
Oh,
going through a
wow.
whole host of things. Literally, it caused the marriage to break down, and he just couldn't understand. And also, the woman that was going through menopause didn't really understand it herself. So she wasn't able to explain that to her husband.
Hmm.
So yes, of course, we need to, first and foremost, the woman needs to understand what's going through her body, but partners, they need to also understand that this is also an interesting transitionary period whereby, as you said, for patience, understanding, so that they both can work through things together. Because one of the things that one of the ladies was laughing about was a brain fog. So she'll
Yes.
call her husband, she'll be like, I can't remember what I called you for. And the husband was like, come on, just tell me. So now when it happens, he said, I understand, I'll come back. So
Oh,
it's enough
wow.
about it now. But to get to that stage, it takes understanding and informing yourself of what could happen and what the symptoms are.
Yes.
Yeah, so it's a joint approach.
Yes, indeed. It is. And everybody's hands should be on deck because this is a life altering, life changing phase
Mhm.
where it's either you sink or swim. We
Mhm.
all have to go there. So yeah, this is awesome. So how I would like to find out from you, being the tech expert here, how you think that really these health solutions could um, you have already talked about improving the patient or the patient experience and whatever, but how would you suggest enrollment diversity and you spoke about bringing persons of underserved communities, minorities, and all that into the mix as regards clinical trials.
Mhm.
How do you think that increased enrollment diversity would could be what should I say, could be enabled to conduct clinical trials, especially where you are in the UK? How would you go about that? Because, sorry, a lot of persons of color are very, very skeptical about clinical trials. Do you know?
For sure, because we're not really including the data. We know, I'm not
Yes.
this woman, this book called The Hidden Data Bias, so we know that, for example, women are at a disadvantage anyway because the data is heavily biased towards against them.
Hmm.
More men are involved, but also when you break it down further, ethnic minorities, there's not much data out there for us. So
Yes.
therefore, I'd say, how can therefore tech solutions be created to involve women from all the different ethnic minorities?
Hmm.
So this is where the data is needed. Um, there's huge potential here, but it starts from people like myself and other women from ethnic minorities really pushing for this. It
Hmm.
is not a one-day thing. It's not going to be it's going to be a continuous process. I was speaking with a lady a couple of days ago. She's a white lady, and she was saying that she's also diversity and inclusivity advocate. And she said, "You're the only black woman that I know that's an entrepreneur within Yorkshire, woman."
Wow.
So
Wow.
that's quite a huge statistic, because when I used to live in London, it's a hugely diverse community. Yorkshire is a complete different demographic. So you've got that culture divide as well.
Hmm.
Um, it's about getting the data. And I look forward to the time whereby we're able to predict when a woman is most likely to go into menopause. So therefore, she's able
Hmm.
to prepare herself psychologically,
Yes.
emotionally, to go through this phase. But to do this, we need data.
Hmm.
And this is something where we need to be lobbying to the government, but also to tech innovators, say, look, this is important. We need to be included. Not to do it in terms of really kind of bashing, but really just saying, showing the benefits. These are the benefits of really ensuring that data is from a diverse, pool, rather than always
Yes.
getting from specific cohorts of data. I think when we can sell the benefits and see the importance of it, we are then able to then move forward and hopefully, lessen the gap between the digital divide and also the inclusivity device to making sure we include as many people as possible. But the key is data. And I think now COVID-19 is really, as unfortunate as it has blown the wide of completely, exposed a whole host of issues.
Yes.
And I think now we're beginning to be, and the government is very much aware of it in the UK, what needs to be done to
Mm-hmm.
be foster these innovations. So there are grants, if they really create an environment to ensure that entrepreneurs from different diverse backgrounds are bringing the innovations in and to get the support to be able to bring it to market.
Mm-hmm.
Yeah.
Yes, indeed. You're absolutely right. They're the pros and the cons, actually. I'm all for clinical trials because without clinical trials, I wouldn't be here. A lot of cancer patients wouldn't be here.
Yeah.
So I'm very for that. But at the same time, uh, Black people and, of color are still very, because of past histories,
Mm.
you read about the Henrietta Lacks
Yeah.
thingy. She wasn't told that her cells had been taken for research and, not compensated. You hear a lot of things. So, yes, there's the issue of not not being comfortable about clinical trials. And then there's another issue of, are these companies reaching out to Black people of color, minorities, or whatever, to say, hey, you guys, we want you to participate in. So at the same time, that information should be made available
Mm.
to those populations to say, we cannot bring about data if you guys don't come. Hold my
Yeah.
hand. It takes two to tango. So while we
Yeah.
might say, oh, okay, we are left out, we should also be, even if we're left out, we should also be coerced or invited to the table
Yeah.
to be part of the discussion and to be part of the trials. So it's, with that, I think that would be a win-win situation for everyone. It will take time.
Yeah.
These conversations we're having, we might see the outcomes in the next 10 years even, but at least
Yeah.
we will start from, we will start from now. That's fantastic.
Yeah.
um, yeah, I know the UK is doing very well as regards a lot of innovations, tech
Yeah.
innovations, cancer treatments, and all that. So I'm sure there's a few. How do you see the potential of digital solutions regarding women's health 10 years from now?